Good morning, Dr. Lam.
Good morning, Jim and Ada.
Thanks very much for joining us. So could we ask you first, do you see a greater role for traditional Chinese medicine in this forthcoming screening exercise?
Well, Chinese medicine has been here all along, even before Western medicine landed in Hong Kong. And it's all along been welcomed by the community for hundreds of years at least. So there is certainly a role for the continuation of Chinese medicine in Hong Kong, especially in the primary care level.
And what aspects of traditional Chinese medicine, Dr. Lam, could be best used for, let's say, middle-aged people and elderly people?
Now, traditional Chinese medicine is particularly strong in terms of prevention of diseases and to mitigate the complications of diseases. It is not only about treatment of diseases, it is also about how to live a healthy life and a healthy diet. And interestingly, medicine and food in Chinese medicine is a continuum. So some food are used with medicinal effects, and sometimes we embed those into our diet. And that keeps people healthy. Of course, you need to know how to use it. So there's a lot of wisdom and a lot of knowledge that you have to teach the people. Now, in terms of blood pressure and blood sugar control, there are some research studies done in our local universities and also in mainland China about the use and functions and the efficacy of several medicine, Chinese medicine. But how those data can be combined together with the Western medicine data is something we really look forward to. Because when you talk about a development of screening program or the control of chronic diseases in the community, one very important aspect is whether our treatment has a scientific basis. Because scientific basis is the principle of development of modern-day medicine. Now, we do have scientific basis for Chinese medicine in recent years, but those data are basically not very systematic so far. So there's a lot the universities in Hong Kong have to do, and in collaboration with the government, of course. And the best outcome would be embedding those outcomes, those studies and the data into a kind of a guideline so that all medical practitioners, whether they're Chinese or Western, can follow the guidelines and cross-refer whenever that is suitable and beneficial to the patients.
And this screening exercise that we mentioned, it's due to start next month. It'll be looking for diabetes and hypertension in particular in people 45 and over. So, you're saying that the qualities of traditional Chinese medicine could be very useful in detecting those conditions?
Not only detecting, but also treating and preventing those conditions. But now, the problem is that we do not yet have a guideline. And it will be quite difficult to ask a Western doctor today to refer a patient to his Chinese medicine counterpart. First of all, he doesn't know when to refer is the best time. And secondly, he doesn't know the efficacy of the Chinese medicine on his patient. So there needs to be some more guidelines and at least some scientific paper around so that doctors can decide.
Dr. Lam, now, who should set up these guidelines? Should it be like the Commissioner for Primary Health, or there'll be a new Commissioner for Traditional Chinese Medicine Development, right? But that post is only in a pipeline.
It's in a pipeline, and they are recruiting people. So both posts that you just mentioned are essential. The Commissioner for Primary Health Care should be the final person to amalgamate those guidelines into those data into a usable guideline. But then the Commissioner for Chinese Medicine Development should steer the amalgamation of those data by the universities. So he should liaise with the local and mainland universities and to really looking into those data by systematic analysis or meta-analysis so that the data are usable. And then together they can make up a guideline. Well, actually, we do have guidelines. There's a reference framework, a Hong Kong reference framework that this kind of guideline for doctors and healthcare practitioners to use, and it encompasses common diseases, including hypertension and diabetes. But up till now, most of those guidelines, or probably all of those guidelines, are along Western medicine line. And I would not be surprised if we can add some Chinese medicine elements into those guidelines when we have the data. So everything has to be based on science.
Right. So who should be the driver in making sure that, deep down in the community, all people understand that Chinese medicine could be used alongside Western medicine, for chronic illnesses? Would it be the district health centers that are now being set up?
Now, eventually it will be the Secretary for Health to steer things forward. But then the actual work should be done by the to-be commissioner for Chinese medicine development. And then that has to be done in liaison with the universities. And finally, the outcome has to be channeled to the commissioner for primary care. And then that can be promoted through the chronic disease co-care scheme and other future schemes.
And we're talking about two very different systems, of course, traditional Chinese medicine and Western medicine, each with their own terminology and jargon. I mean, would you foresee any difficulties there that have to be overcome?
Oh, of course. It's just like two different languages, but then there can be translation in between. And over the years, I think we're becoming more and more accustomed to each other. And if you look at the few Chinese medicine program in Hong Kong, students have to study some basic Western medicine. And even for the two medical schools in Hong Kong, Western medicine students may elect to study some basic Chinese medicine. So the first thing is to get to know each other well. And after that, I believe human is human. Diseases doesn't differentiate themselves in the Chinese medicine disease and Western medicine disease. So we should go hand in hand and treat our patients together. That's in the long run.
Yeah, there are like 8,000 Chinese medicine practitioners in the community.
Right.
What sort of training do they need so that they could be integrated into this bigger picture of primary health care?
A good question. Now, in the future, I believe all new Chinese medicine doctors are trained in the universities. So they have formal training. And parts of the training would also be Western medicine. And then next step is to integrate them into, really, you have to ask them whether technology such as X-ray or blood test will become part of the armamentarium of Chinese medicine. It is they who should decide. But then if they decide it is up to them to use, then I believe there should be training courses to equip them with the necessary knowledge of using like X-ray, especially with regards to the hazards of X-ray and the interpretation of blood test. Now, biochemistry and X-ray are not patented by Western doctors. They're patented, they're not patented, and they are sciences. So how to use science is really up to each individual profession's own development. And if they think it is useful to them, then by all means, we should allow them to use it. But of course, we are concerned if they can really interpret the data correctly, and if they know the pros and cons of using those investigations. So these are subjects that should be embedded into the Chinese medicine undergraduate training. And so in the future, I believe all our newcomers will be university graduates, and they have a high level of education, and also they know how to interpret data and conduct researches. So that helps the cooperation of the two systems greatly. And if you just look back into history, for at least 200 years, we have a dual system in Hong Kong. That is, both Chinese medicine and Western medicine are in our community, and people just use them. Although we do not have a formal cooperation between the two systems, patients themselves, they see different doctors, Western doctors and Chinese doctors all the time. So they're testing the use of medicine on themselves, and people has a general knowledge of when to see which one. So that's the kind of wisdom we have to systemic.
Right, but let's say at the University of Hong Kong and CUHK, where there's a big faculty of medicine, how much time do they allocate to at least understand, the practice of Chinese medicine? Do you know, or is there nothing at all?
I'm not quite sure of the actual hours, but I understand that in Hong Kong U, medical students, undergraduates, are expected to take some courses in Chinese medicine.
Right.
I don't think that is a lot of it. And on the counterparts in the New Territories, Chinese University of Hong Kong, there are elective courses. So students can elect to take those courses, but some do not. So I wish to see that it's made mandatory for medical students to know at least a little bit of Chinese medicine and vice versa.
Okay, Dr. Lam, so I know you can only be with us until 9:15, but thank you very much for joining the first part of this morning's programme. That was Dr. David Lam, legislator for the Medical and Health Services.